Thank you so much, everyone, for joining us. A warm welcome from Open Digital Health. And the title of today's seminar and discussion is, okay, got it. So the title of today's discussion is The Future of Digital Health Promotion and Treatment. So warm welcome from Open Digital Health team. We have several people who kindly contributed to the initiative and who continue to work on Open Digital Health. And I have a pleasure to introduce the team of directors. That's myself, Dominika Kwaśnicka from University of Melbourne, Gjolt Jorn Peters from Open University in the Netherlands, Robbert Zanderman from Twente University, also Netherlands, Gil ten Hoorn, University of Maastricht, Netherlands, Olga Persky, University College London, UK, Keegan, University of Jyväskylä, Finland, and Sebastian Pothoff, Northumbria University, England. So the issues we're going to discuss today, it's firstly, we warmly welcome to our initiative. We will provide a strategic overview of Open Digital Health. We will provide the rationale for why we set up Open Digital Health. We will tell you a little bit more about the living review and a database that will underpin the way how we're gonna categorize and systematically place different digital health tools on our website. We also tell you a little bit more about finance, fundraising, and partnerships. We will talk about the events that we are planning to have this year. We will introduce our mentoring scheme, and we will say a little bit more about engagement. So firstly, what is Open Digital Health? And I think the majority of you now knows that this is a not-for-profit organization that aims to encourage health scientists, practitioners, and technology developers to share evidence-based digital health tools. As I said before, we are creating a searchable database of descriptions of evidence-based tools, apps, websites, devices, and we're hoping that by doing so, the digital health will grow faster, be cheaper, and much more transparent across different countries. We want to share digital health tools and provide opportunities for faster breakthroughs in digital health field. Our mission is to move health science forward by advancing the progress of evidence-based digital health technologies. And our vision is to make digital health open, scalable, and accessible for all. So I would pass it on now to Robbert, who will say a little bit more about why we set up Open Digital Health.
Yeah, why we set it up? Well, that starts effectively on a bus a couple of years ago when Dom and I were at a conference of the European Health Psychology Society, and there was not a direct connection from Galway to fly out to your home cities. So we had to take a bus with the whole group from Galway to Dublin. And then we sat together at the bus and discussed the fact that we saw at the conference loads of e-health apps being presented, being done research on. And exactly, we had the idea that it would be a great thing if it was possible to share more of the knowledge and to be more transparent. And for example, currently I'm involved in a project, as an example, I'm currently involved in a project where we work on an e-health app, which is aimed to help out patients with cancer with a self-compassion sort of online treatment with all kinds of informational stuff, but also all kinds of exercises for the patients. Now we have the problem, the project's almost done, and then the question is what to do next. And it would be, of course, very nice if it would be possible to share such an app with other researchers who could add their own stuff to it. For example, in a different country, in a different cultural setting, but also perhaps with another group of patients where similar adaptive challenges are there, but which might need to tweak the app in a different way. So that was where we started to discuss this whole issue. Would it be nice if we can share once an app is being developed with others to innovate it and to make it also applicable for other cultural settings and for other patient groups? So that was a simple idea where we started.
Thank you so much, Robert. Beautiful. And I think quite a few of us have very similar stories when we work on several digital health solutions and tools. We put a lot of work and effort into developing, designing, and testing them. However, we may have not the opportunity to promote them at scale, to implement them at scale. And unfortunately, they kind of ended up on the shelf, ended up on the drawer. And what we want to do here is to promote open, transparent, and shared digital health that continues to be reused. So the way to promote those different tools, and one of the tasks that we set ourselves to do, is to build the living review and a database where we can index those different tools and solutions, such as the cancer app that Robbert has mentioned, but maybe many other different solutions that are out there that the designers and developers are willing to share the content, the code, maybe the design features, and are willing to give them to other research teams or to other developers to then reuse and repurpose them. So we want to avoid we want to avoid waste, and we want to build this database which will index available digital health tools, but will also allow people to register prospectively what sort of digital health tools they're working on. So we aim to develop a first version of such a database through firstly conducting a modified Delphi exercise. That's a consensus exercise where we would like to agree on the entities that we want to extract and index in our database. So some of them we know we want to say, is it an app? Is it a website? Is it a specific wearable? But there are several other things that we can be indexing by country of origin, by population that the tool is designed for, or maybe the population that the tool has been tested with. The second step will be conducting a leading systematic review of existing, but also upcoming digital health tools. And the leading systematic review differs from the kind of traditional systematic review in a way that it basically allows to update it very frequently, and it's the database and the systematic review that can then be placed on our website and that can be accessible to other technology developers, to other users, etc. We also want to set an open architecture for populating a living database, so other researchers or practitioners will be able to contribute and list what sort of product, what sort of solution are they working on. So we will go through 5 phases of systematic review that includes planning, searching, screening, extraction, and data synthesis. We will recruit collaborators with expertise in behavioral science, healthcare clinical practice, computer science, app development, user experience, and policy making. And we will strive for wide planetary representation within this group. And that work package is led by Olga and Gjolt Peters. Within our initiative, we also setting up partnerships and collaborations. We would love to collaborate with several institutions. We would like to be affiliated with other groups that also have similar aims to open digital health. And so far, we've gained affiliation with 3 societies, namely European Health Psychology Society, Society of Behavioral Medicine, and International Society of Behavioral Nutrition and Physical Activity. However, we're hoping that with time, we will attract many other supporting organizations that will help us promote open digital health.
Morning, everyone. I'm just going to say a few words about our event series. So today you are all here for our first initial launch event, which is really exciting, and to see that we have so many people who are interested in this open digital health sphere. And the events that we have set up now and that we are going to facilitate in the future, they are really there in order to enable networking and knowledge exchange. So if you think about the example, the little story that Robbert was telling, just imagine that, let's say you are a team of researchers and you have developed this app. So if you want to get it out into the wild, let's say, what's really important is that you make the right kind of connections. For example, you might want to collaborate with some practitioners in order to disseminate your app in a clinical practice, or perhaps you want to work with some industry partners in order to develop the app further and adding some nice features. So in this sense, networking is really important, meeting the right kind of people. So the events are really set up in order to enable that networking. And we are really setting out to build a hub for transdisciplinary collaboration. And for this hub, we would really like it to be extremely inclusive. So like I was saying before, we encourage industry partners, policymakers, researchers at all stages of their career to join these events and engage in the discussions and the conversations that we're having here. Next slide, please. So why should you join these events? And I will talk about what the types of events are that we are organizing. But just firstly, the benefits of joining these events is, of course, to learn about cutting edge research on open digital health. So for each of the events, we are inviting a range of expert speakers, again, from different disciplines, different levels in their careers. And it provides an opportunity just to meet some like-minded people, some people that you might not regularly talk to. Perhaps, again, you are very much oftentimes working with people that are very close to you. So this gives you an opportunity to talk to people from across the globe, from different disciplines, and to form these interesting connections. Next slide. So these are the 3 different types of events that we are organizing. And in fact, if you go to our website now and go to our events page, you will see that we have already set up for you a really fascinating, interesting series of events, including discussions, webinars, and workshops. So the discussions are really brief talks by invited speakers, which are followed by interactive discussions. So these are very short, 15 to 20 minute presentations, which will be recorded and also made available on our website. And then the speakers will invite the audience for discussions in a very informal, safe space for people to share their interesting viewpoints. The webinars are invited keynote presentations by prominent speakers, followed by questions and answers. So a little bit more the kind of classical keynote that you would also see on a conference. So a little bit longer presentation. And we are also offering topical workshops in order to help build capacity in our community around open digital health, different tools that you might want to engage with, different methods to help you with your research or with your practice. And these workshops will include a mix of brief presentations, small group discussions, demos, and other tasks to facilitate learning. And all of these events will take place via Zoom. They are all free to attend for our members, and they will be recorded and made available in our resource library. So this is just a screenshot from our website, and I'm sure you've already found your way over there. So here you can see this is where you basically access the different types of events, discussions, webinars, and workshops. Next slide, please. And then you will see the list of events that are coming up for each of the calendar month, and you can just click on them. You will get a brief description like this upcoming discussion, and you have a button. So again, with the time, the date, and all you have to do is click that register button. It will ask you to become a member, which again is totally free, and it will give you access to all the events, our mentoring scheme, which Gil is talking about in a second. And once you become a member, you can also create yourself a really nice profile. Like you can see my profile here with a nice background. You can provide a brief bio about yourself and a link to your personal website. And you can also say whether you want to be a mentor yourself. Next slide. Okay, and once you have clicked register, you will be forwarded to this screen, and we also have a fancy option here to add the event to your Outlook calendar, so you have it right there with the Zoom link provided. Okay, that's it about the events, and I'll hand it over to Gil.
Yes. All right. As Seb already mentioned shortly, we also have, next to the Living Review and database and events, we also have a mentorship program. So we offer a unique mentoring scheme for researchers, healthcare professionals, and technology developers. And that mentorship program can be found under that mentorship button. The reason that we have this mentorship program is that all researchers, healthcare professionals, and technology developers have experience and expertise that they can share. So if you think you have expertise that you can share, you can sign up as a mentor. And if someone else then expresses interest in you as a mentor, we inform you and you can decide to arrange an initial meeting. The idea of these mentorship programs, you can go to the next slide on, is that this mentorship can take multiple forms. So you can have a single meeting, a single consult, you can have a mentorship throughout a specific project, or you can develop a continued mentor-mentee relationship. And of course, this is up to you and the mentee later on. Of course, some benefits of being a mentor are, amongst others, that you contribute to your discipline, you support the next generation of researchers, healthcare professionals, and technology developers. You can further develop your own mentoring skills, and you can share your perspectives and expand your own views and knowledge as well. Next slide, please. But next to the mentors, we also have a mentee. Of course, you also have the mentees. And the idea there is that we can all learn from people with relevant knowledge and expertise. So you can also, at all stages in your career, sign up as mentee. And again, here, if you express interest in connecting with one of our mentors, we will contact the mentor on your behalf, asking if you are open to arrange a one-on-one session. And if the mentor then agrees, a first session will be planned, and then you can discuss what kind of type, form, and meeting frequency best work for both of you. And of course, the benefits of being a mentee is that you collaboratively solve problems, set your career strategy, maybe receive suggestion and fresh perspectives from a mentor. You improve your knowledge and skills. And with some luck, you are also able to develop confidence in your abilities, commitment, and motivation. Maybe lastly, we can only make this mentor program a success with your help. So therefore, we want you to become engaged and that you share your expertise with other people all over the world. But that will probably be in the next session also discussed more.
Thank you so much, Gil. So final few words on engagement. So we would like this initiative to be promoted among our networks, but also among your networks. So to do so, we created a social media platforms where we would be posting relevant information about events, about resources, updates about mentoring, and updates about how the initiative is progressing. So you can join us on social media, and here I included all the links, but you can also scroll down at the bottom of our website. There is all the socials that we would like to engage with different audiences through. So we have Twitter account, we have Facebook, we have LinkedIn, and we also have Instagram. But if you're a person who doesn't really use social media, you can also simply register as a member, and we would also have a newsletter, and we will also send information to our members without having the need to check the social media. So Seb already mentioned how to register on our website, and he also highlighted some benefits of being a member. So it's, again, joining that international community of researchers, healthcare practitioners, and technology developers, attending events, taking advantage of the mentoring scheme, presenting your work, exchanging ideas, and also planning some joint projects, collaborations, grants, plans, whatever you think will be relevant for you. You will also hopefully have an impact contributing to the reuse of open digital health tools. So when you log into our website, you can see all of our members, and each person who joined as a members can create their own profile as the one that Sebastian has showed to us. And also on this map, you can see people who joined so far, and hopefully in the next few months and years, when we look at this map, the members pool will grow continuously. Our initiative also has a network of national leaders, and they're also listed on our website. Currently, we have 33 national leaders from 28 countries. And we hope that those national leaders will ensure country representation, dissemination of open digital health work, and also promotion of our initiatives, so we can ensure that we're working collaboratively across different countries and across different settings. Also, what's really beautiful about our initiative is that we have representatives from several countries where digital health is really prominent, but also we have representatives from countries where digital health is still developing and evolving. And there are a lot of opportunities for shared learnings, and there is a lot of opportunities for cross-country implementation and translation. National leaders will meet at least once a year, and they will provide this strategic cross-country direction for the open digital health. And also, if you go to our national leaders country list, and if you realize that your country may not yet be on this list, please get in touch with us if you are keen to join as a national leader of the country that may not yet be represented. And also, if there is someone who works in your country who already is a national leader, please feel free to contact them, and please feel free to work together with them in order to collaborate and to share learnings within and between countries. So that brings me on to the final part of our presentation today, and I think that's probably the most important part, when we would love to hear your feedback, and we would love to get some opinions and reflections from you joining us today. We would love you to also help us to make this initiative be scalable across countries and settings. And we think there are a lot of ways how you can also join us, contribute. We would love to hear any of your suggestions, reflections. Thank you so much. And I will stop the screen